Hi, I'm Dr. Darria, and here are my top 10 must-have products for your baby's health in the first year. We will also go through 4 no-no products. If you have them in your home, you can get rid of them for now. Number 1 is a good thermometer. Any ER doctor or pediatrician will tell you that especially in those first 3 months, you really need to have an accurate temperature. So the best way to do that is, sorry guys, rectal temperature. One rule of thumb is make sure that you have the rectal thermometer and you keep it very separate from the oral thermometer that anyone older in the home or the adults will use. You don't want to confuse these two. Just make sure when you're doing a rectal temperature that you use a little alcohol swab to clean it off before and after, and a little bit of Vaseline. You're going to get the most accurate reading. Number 2, depending on if your child has a fever or pain, you're going to want to have medications to help address that. Now, there's liquid acetaminophen and there's liquid ibuprofen. Now, ibuprofen you wouldn't want to use until your child is at least 6 months. Both of them, talk to your doctor before giving them to your child. One ER doctor trick that I have that we use in the ER all the time is rectal acetaminophen. Now, tell me if this is you. It's 2 in the morning, child is cranky, you're exhausted, you can't see straight, and you give baby the liquid medication and they spit out half of it. So now what do? Do you redose it or do you just wait and see if it works? Make your life easier, use rectal acetaminophen in the first year or so. During that phase, you'll know exactly how much your child received. They're not going to be able to spit it out, and that makes them feel better and makes your life easier. When they get a little bit older and you're able to use the liquid medications, and again, this is ibuprofen, is Advil or Motrin, acetaminophen is Tylenol. I recommend always giving it with a syringe into their mouth. That makes it easier to make sure they get the full dose, as opposed to those little cups, which can be hard to give them the right dose and they don't always drink it all. Next product is a cool mist humidifier. We use cool mist in the ER whenever a child comes in with difficulty breathing or coughing, and it's the same thing you can use at home when they're congested or have any cough or cold. Use this one. This one is by Crane. I love this. Use this for my baby. Use it for myself when I get sick. It's a great one to have in your house. Now, group number 8 is Diaper Rash cream. I remember thinking, there's so many products on the market. What do I use? Here's your rule of thumb. Prevent diaper rash with petroleum-based cream, and then if they get a diaper rash, use a product with a zinc oxide. Now, the petroleum-based ones are Aquaphor, Vaseline, A&D. The zinc oxide one, Desitin, Boudreaux's butt paste, triple paste, a lot of different varieties. That's what's going to help you if they get the rash. Now, another good old mom's remedy is when baby starts to have a rash, I stop using the alcohol or even alcohol-free wipes and I start cleaning their bottom just with plain old water. Use water, use a towel to dry it off, and then if you have an old hairdryer with a cold air setting, you don't want to use the hot air setting, but a cool air setting, then you can use it to make sure the baby's bottom is really, really dry. Now, some people say let the baby run around without a diaper until it's dry. They're braver than I am. I used towels and a cool air setting on your hairdryer to make sure the baby's bottom was really, really dry. Then you put on the diaper, because that dampness is what you want to avoid, and in both preventing and treating diaper rash. Now next, again, if baby's congested, one of the great things you can use is saline spray. Spray a little bit up each nostril, and then suction. You can really use either one of these. You can use the bulb suction that we use in the ER, or for the more intrepid of you, you can use something like a nasal Frida where you create the suction yourself. Either one works, and it really comes down to what your child tolerates and what you, as the parent, tolerate. Now, group number 9 of products you need to have is if your baby has dry skin or any eczema. My daughter has a lot of dry skin, so one of my favorite products is Aveeno Baby Eczema Therapy. I use this on my hands too. It's a great cream. Another one is Eucerin Baby Eczema Relief. You can use these, whichever one your child tolerates better and likes better. They both work very well. And product number 10, you guys, I'm obsessed with this. Tell me if when you first brought baby home, if you were not terrified to trim their fingernails. This makes it so much easier. And baby actually likes the light. So I find that they're more likely to let you trim their fingernails, at least for a little bit of time. You can see exactly what you're trimming, making it less likely that you'll catch any skin or anything else, making the job of trimming fingernails that much easier. So those are my 10 must-haves. 4 that you don't need that can really be harmful to your child. Number 1 are those baby teething gels or baby teething tablets. The gels are Oragel or Ambisol, and they have a medication called benzocaine, which can cause a very rare but very serious condition known as methemoglobinemia. So we don't recommend that parents use those, nor do we recommend some of the more homeopathic tablets, which the FDA is currently investigating because of adverse effects that children have had, such as seizures. Product number 2, amber necklaces. Again, a product for teething that shows no evidence showing that they are beneficial, and we do see injuries from them. Just this past October, a little boy strangled when his amber necklace got caught around his neck. Or we see children that choke when the amber necklace beads break off and the child swallows them. Product number 3 you don't need is aspirin. We don't recommend that this be used in any child, infant, or even early teenager due to the risk of Ray's syndrome. And product number 4 is cough and cold medication. The American Academy of Pediatrics now recommends that you don't use these medications until your child is 4 to 6 years of age or older. Use these other medications when they get congested, and you'll have the remedies you need. With these top 10 products, you'll see that the list of things you actually need to keep your child healthy is actually a lot shorter than the lists you may have found online. These are the 10 must-have products. I'm Dr. Darria. Keep your family safe, healthy, and out of the ER.